Hello everyone, welcome to sqadia.com and my name is Saima Mushtaq and our today's lecture topic is how to take obstetric history and examination. We divided our lecture into 5 sections. In the first section we will talk about the history, and in this we will talk about the social and family history, history of present and previous pregnancy, and dating the pregnancy and previous obstetric history. In the second section, we will talk about the examination of the pregnant patient, and we will talk about what are the symptoms of pregnancy and pseudo-psychosis, general and systemic examination, and limbs and skeletal changes during the pregnancy. In the third section, we will talk about pelvic examination of the patient, assessment of the bony pelvis, planes of the pelvis, and outlet of the pelvis. In fourth section, we will talk about obstetrical examination, abdominal palpation, measurement of symphysial fundal height and abdominal girth, and also we will talk about the palpation of fetal parts. In the fifth and final section of our lecture, then we will talk about presentation and position of the baby, and in this we will talk about what's longitudinal lie and position of head in vertex, station and engagement and auscultation of the pregnant patient. So all these topics will be covered in our today's lecture, Obstetric History and Examination. So to learn more about this topic, keep watching sqadia.com.